We've had the LenSx since early 2010. So we've had a chance to really use it, see its different iterations, certainly have used it from the very beginning for incisions, both primary, secondary, and the arcuates. It's continuous improvement. Like everything that Alcon LenSx has done, they've constantly iterated it, constantly improved not only the incisions themselves, but the diagnostics, the OCT, the resolution, the placement, the algorithms. It's just been a very rewarding experience to be along that ride.
So we've had the LenSx laser for 2 years now. And what's been remarkable is to watch the evolution of the product. Its ability to accurately make incisions in both the cornea, the anterior capsule, and the lens has increased dramatically in just 2 years. The number of software renditions, improvements, remarkable. We're going to see more of that.
There have been a number of very important improvements in the technology since we've been using it. The enhanced OCT image obviously is a great improvement. When we first had the OCT technology early on, it was really gee whiz, wow, we can see the eye. And then as it got better, we're like, wow, we can see the eye in amazing detail. So we're really getting spoiled by the level of just amazing visualization that we can now have for these patients. The flexibility of making the incisions, the ability to tailor the incisions has continuously improved, doing different types of incisions, different types of arcuates. All these things have gotten better. There's been more things we can do and better ways to do the incisions. The soft fit interface has been a great improvement, obviously one of the most tremendous ones in terms of patient comfort, patient acceptance, and just all of the outcomes that we see.
I've got the LenSx in December of 2011 and have seen tremendous improvements along that way as far as the upgrades and the program changes along the way as we've gone with that. And then we of course changed the PI, got the soft fit in there, and with the soft fit that's been better centration. The OCT images have increased. The energy levels that are needed to do the LenSx have gone down with the soft fit, and so better OCT, better treatments with lesser energy have been major accomplishments that we have seen.
I was fortunate that I only had to deal with the prior software for maybe 6 weeks, and then the soft fit was available, and so I noticed a dramatic difference in the ease of docking with the soft fit compared to the original. And part of that is just visualization. With the prior interface, you would get some fogging, and so it would be hard to center because the visualization just wasn't as good. But with the soft fit, the visualization has been very good throughout the entire process. So if you can see what you're doing, you can much better center, and that's been the case for sure.
LenSx laser, as you know, was the first on the market, but Alcon did not rest on its laurels coming out first. They're upgrading the machine, and the upgrades are in a direct response to user questions or concerns. The LenSx laser with soft fit patient interface and the latest upgrade 2.20 software has radically changed the creation of the capsulotomy. With the upgraded patient interface, the soft fit interface, and the software upgrade to 2.20, the definition on the OCT is remarkably better, and that's what allows you to use less energy when you're making your cuts inside the eye.
And one of the things that Alcon has done, we've seen this all across the board over the years, that Alcon has been involved in surgery, cataract surgery, is to listen to the surgeons and take feedback from surgeons out in the field, boots on the ground every day that are working this, and take that feedback to always striving to make a better product, always striving to provide a better instrument for the surgeon to take care of the patient in the best of his ability.
I think LenSx has been successful because Alcon really listens to its users. Their interest is in helping us do our very best job for our patients. So when I say, hey, there's something about the system that I'd like to be different, or I'd like the capability to do this, that counts, that matters, and the system has the flexibility that Alcon can go back and make changes, make improvements that are really user-driven, that are end-user driven, that allow us to do a better job for our patients. I know that when I made the investment in it, that it was going to be supported and improved, and it has been.
The most successful products are the products that evolve. In other words, what's the best product in the future? It's the product that changes to be the best product in the future. So you need a tremendous commitment to do that. Otherwise, you become the proverbial flash in the pan.
For us, the LenSx is laser cataract surgery. It's been our experience, again, from early on, from early 2010. It is a workstation, certainly for laser cataract surgery, but perhaps more importantly, it takes cataract surgery and it digitizes it. It's really the central effect to the patient. It's a central attraction to the patient. They get the idea that it's a laser. They get the idea the laser's involved in their cataract surgery. We use it for so many aspects, and this is just 3 years into the technology. The incisions, the capsulotomy, all sorts of different fragmentation patterns, tied into the whole planning with the Varian system.
I think it's been crucial to have a team that works very well with surgeons historically and that listens to them, because when engineers make something, they may think one way, and then when it gets in the surgeon's hands, it's something different. So you have to work with a company that works very closely with the surgeons, and that's been a huge advantage.